February, not just about Valentine's hearts. It's also American Heart Health Month, a time to bring awareness to heart disease and combating it with healthy living. Our Tyson White spoke with a doctor at St. Luke's Heart Rhythm Center about the importance of listening to your heart. Tyson.
Justin, according to the American Heart Association, more than 350,000 people experience cardiac arrest each year. And even more startling, only about 10% of those people survive those attacks. Dr. Marcos Dacret with St. Luke's says it's best to be preventative with your heart health.
It's a very important time for us, specifically majority of the treatments and options that we have for our patients requires self-awareness and requires preventive diagnosis.
Heart disease is the #1 cause of death in the U.S. But according to Dr. Marcos Dacret, it's the most preventable disease.
The symptoms of cardiac problems are relatively broad. They can start from what we call chest pain, is basically that oppressive sensation in your chest, symptoms of shortness of breath, the inability to do the things that you were normally able to do, fatigue, tiredness. These signs are relatively nonspecific, but they point towards a potential problem, and that's why I think we recommend patients, if they experience any of these symptoms, to seek help.
Once patients have been diagnosed with a cardiovascular ailment like atrial fibrillation or arrhythmias, Dr. Dacret says there are standard treatments and procedures to help, like prescribing blood thinners or ablations where surgeons modify tissue in the heart using heat to prevent harmful electrical signals. When those standard treatments are not effective, a newer procedure is available.
In the Valley, we were participating in a couple of clinical trials evaluating this newer energy source called pulsed field ablation. That is as effective, if not more effective, than our current treatment strategies, but much safer.
Pulsed field ablation is an inpatient procedure that uses short bursts of high energy or radio frequencies to modify the tissue causing atrial fibrillation. Dr. Dacret says patients recover faster with this new procedure, leading to better outcomes.
Most of them report improvement in the atrial fibrillation. A lot of those patients were able to stop anticoagulation. In a lot of those patients, universally, we stop medications to control rhythm, which are associated with significant side effects and things that also impair the quality of life.
Early detection is key. When you feel something is off or wrong, talk to your primary care physician. Dr. Dacret says a healthy diet and regular exercise will help prevent serious health issues in the long run for your overall health. Justin, we will have more information on what you can do to stay heart healthy in this story on K2B.com.
All right, Tyson, thank you for that.